All right, good morning, everyone. Thank you for joining us for the Whatcom County Health Department's media briefing for Friday, August 20th. I'm Jennifer Moon, Public Information Officer with the Health Department. As we get started, I have a few reminders for participants. After we've heard from our speakers this morning, we'll invite members of the media to ask questions. Please hold your questions until then. This briefing is also being recorded and will be available within a few hours on our media page at www.whatcomcounty.us/COVID. Today, we're going to be hearing from Erica Lautenbach, the director of the Whatcom County Health Department, and also Dr. Carla Pudi, Chief Medical Officer at Peace Health St. Joseph Medical Center. And with that, I'll turn it over to Erica to get us started.
Thanks, Jennifer. It looks like we have a couple more people in the waiting room as well.
They are joining us now.
Okay, great. Well, good morning, everyone. Thanks for joining. I'm very happy to be joined as well by Dr. Carla Pudi, and look forward to his comments after I give a few opening remarks. So I want to start by just acknowledging that we're in the midst of another COVID surge with both cases and hospitalizations increasing rapidly. Our continuing high case rates indicate we've not yet seen a peak with this surge. As you know, we've been experiencing increases, and on Tuesday there were 108 new cases reported. There were 78 new cases reported on Wednesday, 69 yesterday, and we've already seen over 100 cases come through this morning. These are the kinds of daily case counts we haven't seen since the height of the January surge. This surge is alarming, of course, disappointing given all we've done to control this pandemic. We have been taking a closer look to understand what's going on, and want to spend some time talking a little bit about hospitalizations and the case rates that we're seeing among both vaccinated and unvaccinated individuals in our community. But first, I want to clarify a couple of definitions that are important for the discussion when we talk about COVID hospitalizations. So Peace Health reports a COVID-19 positive patients on their website each day. And those are people who are hospitalized for any reason or diagnosis who've also tested positive for COVID-19. Their care requires COVID-19 protocols to prevent infection of others in the hospital, regardless of the severity of their illness. And this number is helpful in understanding changes in our hospital's COVID unit capacity, as well as caring for these COVID positive patients. And we know it's resource intensive. The other hospitalization rate, which is reported by Whatcom County Health Department, are people who've tested positive for COVID-19 and have been hospitalized due to their COVID illness. It does not include people who've tested positive for COVID-19 and are hospitalized for some other reason, for example, a heart attack or a car accident or an injury. And this number is helpful in understanding changes in disease severity over time. So just a careful and important distinction between the reporting of hospitalizations. So I'd like to share what we're seeing in terms of cases and hospitalizations among vaccinated and unvaccinated. And Jennifer, could you put that chart up on the screen, please?
I think Skylar has that.
Or Skylar has it. Thank you, Skylar. Okay. And this is preliminary data, but we wanted to be able to provide you with the most updated information that we have. As you can see, this shows the 14-day case rate in recent months by vaccination status. And what you can see is that unvaccinated people continue to make up the vast majority of cases. But we are seeing that cases are increasing among both vaccinated and unvaccinated people, which is not surprising, given that breakthrough cases are part of the equation, and they will increase as we see more cases overall. but do expect a small proportion of those cases to be among those who are fully vaccinated. We're also seeing that the Delta variant is much more transmissible than previous strains and has displaced all other strains. The increase you can see starting in early July is particularly concerning because that timing corresponds with the rapid arrival of the Delta variant in Washington state. It was around July 4th that the percentage of sequenced specimens in Washington due to the Delta variant went from 10% of the total to about 95% of the total. This has driven an increase in overall case rates, especially among those who have not acquired immunity from vaccination or previous infection. Although data shows that unvaccinated people have a much higher risk of severe disease if they become infected, there is an increase in symptomatic and severe disease among vaccinated persons who are infected with Delta compared to vaccinated persons who are infected with other strains. What we've done to help understand the recent spike is to look at cases and hospitalizations for the 6 weeks prior to July 4th and compare that to the data the 6 weeks after July 4th. We see a couple of concerning things. First, we see an increase in both non-vaccinated cases and vaccinated cases reporting symptoms. And second, we see that hospitalizations among both vaccinated and unvaccinated individuals are increasing. Further, when we look at hospitalization by age, we see a distinct difference based on age. And nearly all of the vaccinated cases who are hospitalized for COVID are people over 65. We have been continuing, we've been monitoring this, and we do see that nearly 75% of the age group over 65 are fully vaccinated, and they have been and continue to be the most vulnerable due to age, underlying health conditions, or poor overall health, and for various reasons immunocompromised. This underscores the reason why people who are vaccinated early can benefit from booster doses to increase their immune response. In contrast, we see alarming rates of hospitalizations among younger adults. However, of the people hospitalized for COVID in younger age groups, the majority are unvaccinated. Let's be clear, our local numbers show that most people who need hospital care for COVID are unvaccinated. According to Washington State, unvaccinated people ages 16 to 44 and 45 to 64 are 10 times more likely to be hospitalized than those who are fully vaccinated. Admissions are about 6 times higher for unvaccinated people ages 65 and up. But the growing proportion of vaccinated cases who require hospitalization among that 65 plus age group is cause for concern and action. Like I said, we haven't reached the peak of this latest wave yet. We are still seeing more cases come in from earlier in the week and no sign yet that case counts are leveling off. The bottom line is we are all at higher risk from the Delta variant. We each have a baseline relative risk based on age, vaccination status, health status, and more, but the Delta variant ups the ante on risk for everyone now. It's important we use everything at our disposal to protect ourselves. First, getting vaccinated. Vaccines do offer protection from severe illness, even against Delta. And masking up. Starting Monday, as you all know, masks are once again required for everyone indoors in public places. Given the surge we're seeing, not just in Whatcom County, but statewide, it will take a combination of continued vaccination and COVID-19 preventive measures to flatten the curve. The governor's announcement requiring indoor masking reflects this reality. So with that, I want to turn it over to Dr. Carla Pudi, who will talk about the evolving COVID disease, what they're seeing in the hospital, and vaccine. Thank you for joining us, Dr. Carla Pudi.
Thank you, Erica. This is Sudhakar doing a quick sound check and video check to make sure you guys can hear and see me. For those of you who don't know me, my name is Sudhakar Karlapudi. I'm an internal medicine trained physician. I work as a hospitalist at St. Joe's, and I'm the Chief Medical Officer for the Northwest Network for Peace Health. And I've been on this journey with all of you in Whatcom County for the last 16 to 18 months of this pandemic. My report today will highlight 3 areas. I want to give a brief update on the changing disease of COVID with the Delta variant, the impact of that has happened on the hospital, and talk briefly about the continued efficacy of the vaccines in preventing severe disease with COVID. I second Erica's statement that the majority of the disease being caused right now resulting in COVID is because of the Delta variant. What we know is that the Delta variant is extraordinarily highly infectious. It is considered to be as infectious as chicken pox. One of the way it is this infectious is that the number of viral particles shed by someone infected with Delta is about 1,000 times more than the number of viral particles that were being expelled by somebody who had the original virus about 12 months ago. So the ability for this thing to generate infectious particles is 1,000 times more than the original one. We know that the changing demographics, as Erica said, it's affecting younger people increasingly, significantly more than the original virus or even the British variant. It has become very common for us to see healthy, I want to focus on that, healthy 20-year-olds, 30-year-olds, and 40-year-olds who are right now very sick and intubated. We are also seeing that this disease is causing significant challenges and disease in pregnant moms. When pregnant moms get this disease, as moms share their oxygen with their baby, and when the mother has decreased oxygen level, it's really, really bad for the baby. We have had to airlift pregnant moms to University of Washington to take care of these babies, and often babies are born premature, so it's causing impact even in a lot of impact in pregnant moms because of the Delta variant. The thing to keep in mind is that I often hear that COVID is just like the flu, and there could be nothing more inaccurate than that. The influenza virus has been with us for a very, very long time. We have a very good vaccination process for that, and the disease it causes is nothing like what COVID does. COVID essentially causes a multi-organ disease. It is very, very injurious to blood vessels, and it injures blood vessels everywhere, central nervous system, heart, lungs, muscles. So it's almost causes a vasculitis, and that's why it causes such an incredible impact on both morbidity and mortality, and it's nothing like the flu in any way, shape, or form. The thing to also keep in mind is that the even mild disease with COVID can result in what we are now calling long COVID. And most recent projections tell us that at least 30 to 40% of people who get mild disease or asymptomatic disease with COVID can also progress to get long COVID. And as we have all seen, these long COVID symptoms can reduce Olympic level athletes to not be, functioning at their normal level at all. So it affects the healthy and causes significant morbidity. So what has happened right now is that with this Delta variant and the people it's affecting, especially those who are not vaccinated, is that at St. Joe's, we have seen a peak of 37 patients. I think it happened early this week. Today we are at 31. We are admitting and discharging a large number of patients that we did not do before. The number of people we are admitting is very high. The number of patients who are actually unvaccinated and with symptomatic COVID disease is about 95%. They have extremely long length of stays. It takes them 8 to 14 days to get better to be considered to be discharged. And on a small portion of patients who have been vaccinated have had symptomatic disease, but they usually go home within 2 to 3 days. So they don't have those long length of stays also. The other thing that we are seeing as a worrying trend we didn't see before is that patients admitted to the hospital but not requiring ICU level of care, we are seeing a higher number of those patients requiring ICU level of care. So we are having to maintain our ICU capacities in keeping up with that demand from our admitted non-ICU level COVID patients over this time. We have always maintained a process at St. Joe's to expand our COVID units in a modular fashion. Our plans have held strong for about 16, 18 months, and we have just refined those plans. We are ready and prepared to expand to meet the needs of Whatcom County. I wanted to reassure everybody on this call that we are ready should that wave happen to us. And we are also working in tight collaboration with our partners in the state of Washington to make sure that all Washingtonians and Whatcom County residents get good care should we get to a point in this pandemic where the surge is extraordinarily high. It is high right now, quite high. The last and final topic I wanted to talk to you about is about the vaccine. As a physician, as a healthcare provider, it breaks my heart to see young people or even people with mild comorbidities get severe COVID-related disease, which is essentially absolutely, in my mind, unpreventable right now. We have moved from a global pandemic that we did not have a prevention for, and now we are dealing with a preventable disease that can, and a vaccine that is highly efficacious. More than 170 million people in the US have gotten the vaccine, and 1.8 billion people around the world are now fully vaccinated. We have seen some breakthrough infections, but it is very, very small compared to the number of people who are not getting the disease. So I think it is really an effective intervention in preventing. The other thing that has become apparent since about March or April is that the UK, United Kingdom, achieved about 80 to 85% vaccination in their country. And they have a process wherein their members, British citizens, send out self-collected nasal swabs twice a week into the national health system. And they have had that process for some time. So when the Delta variant emerged from India and came to the UK, the national health system detected a large number of Delta cases increase, but they did not see their hospitalizations increased, which actually says that they have seen the wave of Delta come through their population, but they did not see the same number of hospitalizations that we are seeing. So right next door, we have a real world proof that vaccinations prevent severe disease, even though we have a raging new variant go through the population. So it is the side effects from the vaccine are mild, and the serious side effects are extraordinarily rare, nothing compared to the risk and horrible consequences of getting COVID. And finally, I'll end this by addressing one more issue. And the issue that I hear is people saying that I got COVID. Why do I need to get vaccinated? And that's a very good question. And we know the answer to that question. The answer to that question is natural immunity or natural antibodies from infection do not protect you as much as the vaccine does. A person who has previously had COVID has 2.5 times more chances of getting COVID again than those who are not vaccinated. And believe me, if you've had COVID once, you don't want to have it again, because the effect of getting it once itself is bad, and the effect it has on your body is very, very bad. So, so even if you've had COVID, please, please, please get vaccinated, because the protection is much better. It allows your body to fight an external invader much more effectively than the immunity you get from being attacked by the virus. So those were the three things I wanted to briefly share updates with you on. I'm happy to take questions, handing it back to Erica.
Thank you, Dr. Carla Pudi. This is Jennifer Moon. At this time, we'll open up to the Q&A quick period. And so I invite members of the media to now type your name and your affiliation into the chat box. And if you'd like to ask a question, and I'll call on you in the order presented. Sorry. If you're unable to ask your question via the microphone, you can type your question into the chat and I will read it out. So I'm not seeing any questions at this time. Are there any questions?
Jennifer, it looks like Robert Mittendorf has a question. I saw his name in the chat box.
Okay, Robert, please go ahead and ask your question. After I unmute you, I'm sorry.
Hey, thanks, Jennifer. I actually have several questions, but I'll ask a couple of Dr. Carla Pudi first, and then let some other people ask some questions. Doctor, how would you describe morale at the hospital right now, especially with the recent protests against the hospital's rule that it's also the governor's rule that employees get vaccinated? What's the morale like in the hospital among staff, if you can speak to that?
Thank you for asking me that question. I think this is the biggest challenge that healthcare has faced in the last 100 years. I think we have been in a constant heightened, how should I say this? It's being at the front lines for an 18-month period, working day and night, seeing your colleagues fall sick and working longer shifts. So this has taken, how should I say, has impacted all of us in healthcare in ways that we did not think. We have taken steps from the very beginning of the pandemic to make sure that the voice of the caregiver, the voice of the frontline is integrated into how we are making things better and how we are improving. We have created venues within T-Cell to help caregivers articulate concerns and also, just acknowledge the long hours that everybody is putting in. Having done all of this, I can tell you that it is hard. It is very, very hard to be a physician right now, a nurse, a CNA, a lab tech, a radiology tech, because we are, everybody is kind of exhausted. And while we are feeling exhausted, we haven't forgotten, and we actually remind ourselves, we know that what we do is very, very important. What we provide as a service is critical to the people we serve. So we talk about it, we stand with each other, we identify caregivers who need help, and we provide help, and we find the resilience in areas where sometimes it's hard to find, honestly, but we stand with each other and get through another day to come back and talk about it and move forward. I understand that everyone has a right to how they feel about their healthcare. It is disappointing when we see community members express their views that sometimes are hurtful to what we have done in the hospital for a very long time, but we understand that it is their right and we respect that. at the same time, it's also our responsibility to tell the community what we see from a purely scientific standpoint. My role is to be able to speak to you what I think is the scientific truth as I know right now. And hence my report focused so much on the importance of getting vaccinated. So I appreciate your question, and I'm grateful that you asked that question for all healthcare workers in Whatcom County. It's very hard, and if you can virtually hug a healthcare worker that you know personally, please do so, because this has been a very hard 18 months for all of us in healthcare.
Thank you, Doctor, and thank you for your service. You hit all my follow-up questions, so I'll yield to Joe and then get in line again. Be safe.
Okay, Joe, would you like to go ahead with your question? Just a moment.
Yeah, hi. Thanks so much. Can you hear me?
Yes.
Yeah, I had a question about the breakthrough cases here locally. Have they resulted, or what's the percentage that have resulted in hospitalizations or deaths among those breakthrough cases?
No, I don't have that data on me, but I'm happy to follow up with you, Joe.
Robert, would you like to go ahead with your follow-up question?
Hi, thanks, Jennifer. Excuse me, this one is for Erica. It seems that some of our elected officials and some people running for elected office are dismissive or at least confused about current science. What do you think the health department can do to persuade our elected leaders, especially?
Thanks for the question. And this is a tough one, as you know, Robert. When I came on about 1.5 years ago, I didn't have relationships with elected officials, and I and my colleagues have been working really hard to build trust and relationship and credibility with our elected officials, bringing in other experts like Dr. K and others to clarify the science and describe the science, and make sure that they are equipped with the best information and data that we have available to us. And beyond that, it's very challenging, and this is obviously a microcosm of a much larger national trend of there being some distrust of the information of the science, and we are certainly trying to combat that as best as we can locally. But we are one county in many counties where this is playing out.
So we're also seeing, in addition to the protests at the hospital that I mentioned, we're also seeing protests at schools against the mask mandates and vaccination requirements. I wanted to ask a yes/no question, and then schools have vaccination requirements and have for decades, so this is nothing new, yes or no. And what will happen if you get an outbreak in a school? Do you have an idea of, like, what the procedure is for, will it be closed down and kids forced to go? Maybe lay that out so we understand that if people go unmasked and unvaccinated, this is the risk. What risk do they take?
Yeah, so first, to answer your first question, yes, there are existing requirements for vaccination of other vaccines as well. So this is not new. It's just new for the community, this particular vaccine. And you said if. We actually already know what this looks like because we experienced it last year. And here's what it looks like when there is an outbreak at a school. And you may remember some reports of classrooms all going home. So what happens, especially what happens when kids are not wearing masks, there is a much greater potential for wider spread. We see this in congregate facilities when people are in close proximity for hours on end with each other. We have a lot of experience with this. So this isn't really an if, but it's a when. And we will have, even despite mask wearing, there will be cases. But if there's not mask wearing, and I know that this has been a subject of a lot of conversation and concern, if there's not mask wearing, this is what happens. There are cases in a classroom, all the kids get sent home for a period of time. All of their parents have to take off work. Some of them will lose their jobs as a result. And a teacher, a faculty, a staff member could also contract the virus because they're in close proximity to the kids and could become very sick. We also know that the Delta variant is having more severe impacts on younger people, including school-age people. So it is a question of when, and we are working with our school districts very closely to make sure that we manage that. But masks are a key and incredibly important tool that we have available to us to not see these kinds of situations happening on a daily or weekly basis where entire classrooms have to go home for a period of time. So that's what we experienced last year. And we will continue to experience and we will continue to manage, but masks are really important in this effort.
All right, our next question is
Thank
from
you, Erica.
David Rosbach at the Bellingham Herald. David, please go ahead with your question. David, do you have a question? You should be unmuted. Okay. While we're waiting for David's question, are there any other questions?
Jennifer, while we're waiting for David's question, I know there have also been some questions and concerns about testing and the volume of cases and the demand for testing. And I just kind of want to address both testing capacity and also our case and contact investigation capacity for your information, media. As you probably know, our testing site at the Bellingham Airport has experienced incredibly high demand, and appointment availability can be days out. We're also seeing this trend regionally, and just this morning, the Seattle Times had a headline today indicating, quote, absolutely crazy demand, unquote, for testing. This is in part because of the demand for travel testing in order to go to Canada that requires a specific test, the PCR test, which is available and provided at our site. It is also available at other sites. Retail pharmacies and healthcare providers can order these tests, and you can find out more on our website, whatcomcounty.us/COVID testing. And there's usually a shorter wait time at those sites for a COVID test. But we are seeing incredible demand. And from a public health perspective, our priority is to make sure that we get folks who are identified as close contacts in our investigations or who are symptomatic, that first priority to get in so we can quickly address whether or not that's a case and what options are available to them. I do want to just share that if folks aren't able to get tested right away and they do have symptoms, to just take the COVID-like precautions to stay home and stay away from other people. This surge is stressing all of our systems. And while back in January, we had often 10 volunteer case and contact investigators available to us every day, when we saw a lull earlier this summer, many of our volunteers, our interns and other paid staff left the health department because we didn't have a demand for their services. And while we are quickly trying to ramp up again, we just hired 4 more people this week and plan to hire more in the coming weeks as we get applications. We encourage people to pick up the phone when we call. We're only able to make 1 call with a positive for people with a positive test. And if you do test positive, but you don't answer the phone or give us a call back, please isolate yourself and keep away from others. And we just really encourage folks to answer the call. It's really important that we have this information so we can help keep others from getting sick and also help us understand where and how COVID is spreading in our community. So I just want to share those points as well.
All right, David Rosbach from the Herald has 2 questions. Last week you mentioned all slots at the airport test center are full. Is there any progress on that? I believe that was answered. David, if you have any follow-up questions on that, you can put it in the chat. The second question is also, the state has been behind with completing data. Do you know how our test positivity is compared to other points in the pandemic?
Okay, sure. And actually, I don't have the specific data, but I know from looking earlier this week that the percent positivity is higher at this moment. But we can get those exact numbers for you as well. And I will share that one of our strategies in trying to address the testing capacity issue is I've reached out to the State Department of Health, and Executive Sidhu has also talked with the governor's office about staffing and resources from the state that could help alleviate some of the bottlenecks that we're experiencing at our testing sites. That said, between the Meridian site for Northwest Labs and our partnership with Northwest Labs at the airport, we have the capacity to run 1,000 tests. And that's just those 2 sites. There are sites all over the county. So if you think about the fact that we're not meeting that capacity, we have an incredible amount, and we've never had it tested to this point. So we are working quickly to try to address it, but it's an ongoing issue. And of course, there are resource requests from all over the state experiencing demands and surge in testing needs. And we can get you the percent positivity as well.
All right, are there any other questions? Robert Mittendorf from the Bellingham Herald. Robert, go ahead and you can ask your question.
Thanks, Jennifer. This is for Erica. Also, you touched on my question a little bit just now, talking about needing to hire more people to get started to testing and contact tracing at levels earlier in the pandemic. Are you finding any more cooperation with contact tracing among people who've tested positive than you were earlier in the pandemic? I know you mentioned some resistance some months ago. Where are you seeing outbreaks? Like stores, offices, private homes, and what's the morale like in your department? You guys must have been seeing the light at the end of the tunnel just to watch it collapse on your way out.
Thanks, Robert. Couple of things to answer your questions, and let me know if I don't answer all of them, but
Okay, thanks.
hiring is challenging. It's challenging for, this is a trend. So where we may have seen 120 applications for case and contact investigators a year ago, we now might have 3 or 4. So it's really, really challenging. We're all competing for the same resources, and certainly hiring people who have clinical experience to help with testing is just really, really challenging because there's a very high demand for clinical staff. To answer your question about where we're seeing spread, I can just tell you that at this point we have 58 businesses that are impacted, and over half of those have what we define as outbreaks. The whole range from very large businesses to very small businesses. The extent of the spread of Delta into our workplaces is very concerning to us because they are already, as we know, short-staffed, experiencing staffing challenges, and trying to sort of pick up the pieces from this last year and a half. And this further hamstrings their efforts to do that. So there are a lot of businesses impacted. And we also are seeing more and more congregate facilities and other facilities impacted by this virus as well. So the spread is real. It is all over our community. And the morale. I kind of wondered if you'd ask me that after you asked Dr. K. It is really it's really challenging. The staff have been working really, really hard for a very long time. I have staff that we are still trying to give a solid week off after 18 months of working, and really trying to balance that. We were able to send staff back to their day jobs. Many of our staff were able to go back to their restaurant inspector job or their on-site sewage inspection job, or other areas, nurse-family partnership. Our nurses were pulled to help with the response, and we were able to send them back to their day jobs. And it's really disheartening for staff to be pulled back into the response after feeling like there was that light at the end of the tunnel. And I think people are just really tired, and they're really struggling with both personally and professionally the impact this long-term response has had on each of us. So it's a challenge. I'm not going to sugarcoat it. It's really hard to keep the morale up and staff motivated and feeling like we've actually we know we've had an impact. We know that we've saved lives over the course of the work. And I know that the hospital has as well, but it's hard to see people, like Dr. K said, people who are getting really sick and some dying from this now preventable disease. It's weighing on us.
Thanks, Erica. Appreciate your candor. Stay safe.
All right, our next question is from Joe Tian at KGMI. Joe, would you like to ask your question?
Okay, thanks, Jennifer. And Erica and all you guys, you are appreciated. Just want you to know that. It seems that it's full speed ahead with fall sports, the obviously full stadium for the Seahawks. High school sports look like they're plowing ahead. Just wanted to get your thoughts on that. Is that safe at this point, or do you expect maybe a change there?
I can't predict what will happen at a state level, Joe, but my priorities for this fall are to get kids back in school and be able to stay in school, to prevent the devastating impacts we've seen in congregate facilities among our most vulnerable, and to ensure that our businesses can stay open and can thrive. We need those three things in place. And if it means that we can't have 10,000 people gather for a rock concert or a sporting event, but those three tenets can continue, that would be my preference. You know, the masking, the social distancing, all of these measures that we know have worked in the past and continue to work will allow us to control the spread of this. It is really hard to see these large gatherings and the resulting impact in our congregate facilities and in our businesses, and the potential impact in our schools. So I don't know what will happen at a state level, but those are my priorities at this point.
Thanks.
All right, our next question is from David Rossbach from the Bellingham Herald. What are you seeing in the morale in the public? I saw a Canadian survey found that vaccinated Canadians are lacking compassion for unvaccinated people who get sick and or hospitalized and die. Are we seeing that same lack of empathy here in Whatcom County from your discussions with members of the public?
I could answer this. I don't know, Dr. Carlapudi, if you have any thoughts as well. I've been talking at length here, so if you'd like to share any thoughts, I'd be happy to go after you.
Thanks, Erica. I think this is my personal philosophy. I think in healthcare, our mission is to serve. Our mission is to educate. Our mission is not to judge. However, we know that a workforce that is tired and exhausted, sometimes it can feel tempting to blame others. And we definitely talk about this in the hospital. And we reiterate that our mission is not to judge. Our mission is to care, educate, and love to the best that we can. Empathy, from my philosophy, is something that we give without question to other people, without putting labels to. It's what we can do to each other in times of great stress, and irrespective of what our beliefs are. So that's something I talk about with my physician leaders too. And when we see a breakdown in resilience, it's very common in these settings to experience what is commonly called as compassion fatigue. And we talk about that and understanding how our role in healthcare is to be compassionate, irrespective of the personal choices by the person who has made. We are here to serve, educate, and love, and not judge.
Thanks. I would add that one of the tenets of our public health workforce is to have empathy. We work toward community health, which is different than individual health. So we aren't seeing people one by one as patients, but we are looking at and tending to the overall health of our entire community. And in order to do that, we need to set aside any judgments that we may have about individuals that are or are not contributing to their own health, but really look at the ways that our systems and our structures and our population can benefit from public health interventions. So we do try to demonstrate those same values that Dr. Carlapudi described, that empathy and compassion, non-judgment, and really working with our community rather than imposing upon our community, and making sure that we can listen compassionately and understand the reasons behind decisions being made in a non-judgmental way. That said, if you, Skylar, who's joining us, is one of the staff members that has the, the distinct honor of monitoring our social media, and there's a lot of anger and vitriol in both directions. both among people who are vaccinated that wish others would get vaccinated, and among people who aren't, who feel strongly about that. There are a lot of strong feelings in our community, like we're seeing everywhere, and a lot of anger and blame, and that's hard to see, and it doesn't move us forward.
All right, are there any other questions? All right, seeing none, we will conclude our briefing for today. Thank you very much for joining us. And as a reminder, this recording will be made available shortly on our website. Thank you and have a good day.
Thanks all.